morning, everybody. My names are Athmani Hussein. I'm coming from Kenya, and here I am is Apollo Hospital in Navi Mumbai. And actually, I came here for robotic surgery, which was done successful. And before that, I was in the country Kenya, where I was having this problem of passing urine. So I went to see my doctors there, Dr. Abdallah and Dr. Soleil. Then they did a lot of tests to find out the PSA, and the PSA was found out to be on the higher side. So when they detected that the PSA was on the higher side, they had to do some biopsy to check. After the X-ray, they showed that the prostate was light. So they said they have to check further after seeing the PSA is high. So they took X-rays and the biopsy when it came, they found also I had some cancers, early stage of cancers on one side of the prostate gland. So they went further to check whether I have cancer in the bones, chest, but they found that there was no cancer in the bones. So they advised me the best thing to do is to remove the prostate. And they told me there are 4 ways of doing the prostate cancer. One of them was open surgery, which is the common one, that is done in Kenya also. And the other one is the prototype, which is they use the machine. And the other one is to implant the cells in the prostate gland so that it can fight the cancer cells. And the other one is robotic. So they explained to me the open surgery, how it's done, and the side effects, because after being done the open surgery, you have a lot of side effects. You find that your urine will have problems, your sexual function will also have problems. So, but with the implant of cells, also it is something you have to be checked every time. It's not a solution. You have to go and have it every time. But sometimes also it fails, it doesn't work. So that one also I said no. So they told me the other one is the only which is not also in Kenya, but they told me about the robotic. Robotic side is the best because it has very less side effects. They will just do to position where the prostate is, and they will make sure remove it, and they will not tamper with other nerves. You can control up to maybe 99% so that the other nerves are not touched. So after that, you find your normal functions will be there after some time, because you can't just go straight away. But the urine will start initially having some leakage, but after that it will go away. Also sexual function will take some time, but still it will go. But the only thing is that now you will not be fertile, because now that is the fertile part is gone. So when they advised me like that, I choose to do robotics. So I was advised to come to Mumbai. I was given 3 choices: either Mumbai, Apollo Mumbai, or Apollo Delhi, or Apollo Chennai. But because I had an experience, I've been in Bombay before, so I said, no, I better go to Bombay. So, and also when I looked at the doctors' qualification, the one of Mumbai was more qualified in robotic and oncology. The others were just robotic, but this one is specialist. And he's trained where I was trained in the UK. So it was very good. So I said I better go to this doctor. And surely what I made that decision when I came here, I met him the first day. I explained to him what has happened. I showed him my reports. And also he explained me what he's going to do. And he was open. He told me everything. day we start until the day we finish. All the side effects, his name is Dr. Ashwan Sunil Tam. The other one is difficult, Tamil something. So he's a very good doctor, special confidence, and he'll tell you, he will explain to you everything about the side effect, the bad and the good of the thing, and other issues after the procedure, what you can go on your medicine. But PSA is the most important part. But that is where you detect. So the earlier you go for testing, I've been doing medical checkup every year through my insurance, through my company, and this thing was being monitored. They could see now the prostate is growing. When it came to the position that the PSA was high, the doctors advised, they said, now you have to have a check, proper check, because here now we are seeing something which is not normal. That's where they went to do biopsy, it was found that it's cancer. Even if it was not cancerous, and it is also bringing problem to urine, you can't urinate properly. And so the only solution was just to remove it. Because to keep on reducing it, it doesn't last. Because every time it will grow back. So when you remove it, that is the end of the system. But actually, PSA is very important. Everybody is advised to go for PSA. That one is the first detection to know that this problem is coming. Early detection is better because now I've been done. I'm sure I'll be okay. There's no cancerous in my body anymore. The thing is out. My life will continue as normal. So in the surgery, I was taken in for operation. I was done operation. It took some time, about 8 hours, because I had an issue with obesity. I was too heavy. So when we met with the doctor first time, he explained to me, and then he told me also, because I had hypertension and diabetic, he had to refer me to other doctors to also come in and give their part of the expertise to check what is there. So I had a doctor from diabetic, I had a doctor for hypertension, I had a doctor for my sleeping, because I had a problem of snoring when I was sleeping. So they find out I have a dyspnea, whereby I should be using a machine. So I had to be tested that. So all the doctors have to go through and find everything is okay, so that I can have a clean bill to be operated. For that, I was not going to be operated. So they checked and they confirmed, and now, according to where we see, is okay for operation. Then is when they decided to do the operation. They could not just come here and do the operation. They had to do their own checks, do everything, echo and all these X-rays, PSA again, and all this to confirm that whatever is seen at home, also here it is seen, so that they don't make a mistake. By that time, all the doctors gave me a clean bill. Then I was ready for operation. So I went in to operate it. It took a long time because of my obesity. And at the end of the operation, I came out. I stayed in the ICU for 3 days. After ICU, I was discharged from ICU. I went to the ward. Also, I stayed for 3 days. Then I was discharged. But when I was discharged, I had to stay with the catheter for another 15 days. After 15 days, I came back, they removed the catheter. And now I've come for review again to make sure that everything is clean bill, so that I can be given a fit certificate to fly home. So that's why today I'm here and giving the testimony that this hospital is good. Dr. Ashwan is good, and the other doctors also good, because they are really concerned about the patient. It's not like you go there, you see the doctor is doing operation and they don't know. He invited all other doctors. They sat as a team and they went through all the checks. Every area was checked until they come to a conclusion now. The patient is okay and fit for operation. Then when they decided now I can go for operation. We thank the nurses, the hospital, everybody was doing his job. It was good. They were jolly, they were happy people. I enjoyed the stay in Apollo. Thank you very much, Dr. Ashwan, for the operation and the knowledge, awareness. Even after this, he has told me how I'm going to go on with my treatment. Not really treatment, but follow-up. Make sure it's checked so that it does not occur. And if there's anything which might come up, I should contact him or contact my urologist there in Kenya, and it is followed up quickly so that it does not occur. He assured me that whatever he has done is perfect. Apollo is a very good hospital. It helps. It does its good job. And I like it. So I pray all the doctors and nurses that they continue the work. Actually, nursing and doctor is a core. You have to have a passion to do that. If you don't have a core and a passion, you can't do it. Because my patients are very erratic. When they the hospital have done, the doctors, and I'll make sure when I go home, even now before I go home, a lot of my people have asked me, how is it there? I've recommended them that it's good, so they want when I go there to tell them the costing, how I did all the staying, and then they'll make a decision to have operation.
So thank you, Mr. Athmani Hussein, for keeping faith in us. We sincerely appreciate your efforts coming all the way from Kenya for getting operated for your prostate cancer surgery by the robot, and we had a obviously good interaction to begin with, mentioning about everything, the advantages, disadvantages of the surgery, the way to follow or the way ahead. We had a lot of interactions pre-operatively, peri-operatively, and obviously post-operatively, and I'm very sure we will be continuing a wholehearted support to you for your long-term follow-up as well. So just a quick message to everyone who are listening to us today. The PSA screening, what Mr. Athmani was saying, PSA screening is very much important to detect the prostate cancer in an early stage. By the guidelines, every man should be undergoing this particular test starting from the age of 50 years, once a year until 70-75 years. And that is very much important for early detection. The robotic surgery scores over the conventional approaches in terms of having extra precision, fast, seamless, and uneventful recovery for the patients who are getting operated with this particular tool. Obviously, not to forget that the robot is the tool, and the main surgery or the entire surgery is going to be performed over the robot by the surgeon. The robot gives us advantage in terms of extra magnification, better precision, and hence lesser blood loss, faster recovery, and early discharge for the patient. For managing certain complex situations, what Mr. Athmani was saying, he was obese, he had some sleep apnea issues, he had diabetes, hypertension, borderline raised kidney functions. So it's a comprehensive team effort which manages these technical scenarios where we sit together, discuss with the cross specialties about the thorough evaluation of the patients pre-operatively, ensure that we are having a safe approach for the patient, and then commit to the surgery so as to have a beautiful post-operative outcome. So I would highlight this particular thing to all the listeners today, that prostate cancer is a common cancer. It's the second most common cancer in a man, and early detection by PSA test and an examination by an expert gives us opportunity to treat this cancer and potentially have a cure out of this cancer forever. So thank you so much for keeping faith in us, and we would look forward to support and give diligent care to you and your close family members for future as well. Thank you so much.